It's so good having you back. You have been such a voice of reason, and you make it where we can understand it. This week, the CDC has said that even vaccinated people may have to start wearing masks all over again when they go indoors. I thought that was one of the reasons we maybe got the vaccination, so we could live freer. Why will that be necessary, and is it necessary? Does the science really back that?
This pandemic has changed a lot as we've been living through it. And I think the game changer here recently is that we're seeing the variant of the SARS-CoV-2 virus called the Delta variant. And it is so contagious that it's really changed the math for us. We were enjoying a little bit of a period where vaccinated people didn't need to wear masks at all. They weren't thought to play any role in transmission. But a significant fraction of our population is still vulnerable, not vaccinated. We're seeing rates of disease going up in the United States now with this more contagious variant of the virus. And people who are vaccinated are protected from ending up in the hospital or protected from death, but they can still get infected and can still spread the virus, even though the risk is lower when they're vaccinated. And so, given the fact that we're seeing a lot of spread of the virus, rates are going up, we're asking people essentially to use a belt and suspenders approach. If you're vaccinated, take that low risk of being part of the chain of transmission and make it even lower. And that's really the ask from the CDC.
When people are thinking about this resurgence because of the Delta variant, I think a lot of people are really afraid we're going to go back into a lockdown situation. And quite frankly, I'm not sure that worked really well the first time we did it. I can't imagine that Americans are ready to go through that all over again. Do we even need to?
Well, where we're at now is a different place. When this pandemic began, and for the better part of a year, everybody on Earth was vulnerable to getting COVID-19. And we really tried a lot of different public health maneuvers to protect everyone around. And now many people have had COVID and many more people are getting or have gotten vaccinated. And so where we're seeing outbreaks are in smaller communities and different regions where a lot of people, for example, are not vaccinated. So the idea that we're going to need widespread quote unquote lockdowns or mandates is much less likely now than it was before. But certainly, we want to do anything we can to keep people safe. And right now, as opposed to lockdowns or mandates, the single most important thing we can do if we're eligible to get vaccinated and can get to a vaccine is to do that, to protect ourselves from getting sick, even mildly sick, but also to protect the people who we may not even know who end up getting the virus because we spread it, and they end up on a ventilator or end up dying from COVID-19. That's what we really need to prevent.
A lot of people are afraid of the vaccine. And I hear that from very thoughtful, intelligent friends of mine who just say, I'm not sure. The FDA hadn't even approved this. Speak to that issue. The FDA hasn't approved it.
That's a really common question and criticism of, I'm worried about getting a vaccine that hasn't been formally approved by the FDA. Of course, these vaccines have been studied extensively prior to being used in the public and showed that they were safe and effective. But now we've seen almost 400 million doses of the COVID vaccines given in the United States under very watchful eyes of the people getting the vaccines, the people giving the vaccines, the CDC, the FDA, the media. And we've seen that they work. They're protecting us from getting sick. They're slowing disease transmission. And they're very, very safe. And so I think that the emergency use authorization, or EUA, has done exactly what we need it to do. And I'm hopeful, of course, that we get formal approval soon so that if that's a barrier for people, they'll drop that argument. But honestly, we know more about the safety and effectiveness of these vaccines than the majority of medications that have been in the market for quite a while.
So FDA approval doesn't mean that we've suddenly determined that it's okay. It's sort of a bureaucratic type of process that has to go through. And everybody knows that normally takes years for a drug to work its way to the marketplace. So that makes some sense. You know, my wife and I have been vaccinated. I didn't have any hesitation because, I'm in the age group, and I just said, I'm not worried as much about what might happen from the vaccine, but I'm kind of concerned about what could happen with COVID. I've seen friends die. I've had friends that have been on ICU. If you were speaking to those folks, which you do all week in town halls, what's the best way that you can alleviate some of the anxieties people have about the vaccine?
Well, first and foremost, as I mentioned, we've given over 400 million doses of these, and serious side effects are really, really rare as hen's teeth. And yet, exactly what you said about COVID is so important. For every 100 people that are diagnosed with COVID, one of those people dies of the disease, and 2 or 3 end up in the hospital. And even young, healthy people can lose their sense of taste or smell for months. They can develop brain fog that makes it hard to work or function. And I have now seen enough people with all spectrum of COVID-19 to not ever wish that disease on anybody. The vaccines are really proving to be safe, and they're keeping people from getting severely ill or symptomatic. And so a lot of it that I do is just trying to listen to people and understand their fears, anxieties, or reluctance to getting the vaccine and just walking them through. Sometimes it's a matter of saying, when we get into our car to go to the grocery store, we're taking way more risk than getting a vaccine. It's much more likely that we end up in a fatal car accident, and yet that has never stopped me from going to the grocery store to buy groceries. So I think we just need some perspective on this as well.
Well, you make so much sense. We love having you, and I'm almost assured that we're going to ask you back. Dr. David Aronoff, we want to say thanks so much for your time and sharing your expertise. Now, if you'd like to keep up with Dr. Aronoff on social media, here's how you do it. Follow him at DM Aronoff. It's on your screen. You can do that. Follow him on Twitter there.